Wondering how much otoplasty really costs and what you're actually paying for? Ear pinning surgery, also known as otoplasty or pinoplasty, is a safe and effective procedure designed to correct prominent or asymmetrical ears. In this video, we'll explain otoplasty cost in the UK, what's included in your quote, possible hidden costs, financing options, and who may qualify for free otoplasty through the NHS. We'll also compare prices and standards between the UK, Turkey, and Albania, helping you make an informed choice for your ear surgery. Otoplasty is a surgical procedure that corrects prominent or asymmetrical ears, improving facial balance and self-confidence. It can be performed safely in adults and children, usually from the age of 5 or 6, once ear development is complete. The procedure is carried out under local anesthesia with sedation, or, when needed, general anesthesia. The surgeon reshapes and repositions the ear cartilage through small incisions hidden behind the ear, making scars virtually invisible and providing permanent results. In the UK, otoplasty cost typically ranges between €3,000 and €7,500. A unilateral otoplasty involving one ear usually starts from around €3,000, while bilateral otoplasty ranges from €4,500 to €7,500. Prices vary by region. They are typically lower in northern England, mid-range in central England, and highest in London and the southeast. The final otoplasty price depends on case complexity, anesthesia type, surgeon's experience, and clinic standards. The cost of otoplasty should include more than just the surgery itself. A complete and transparent quote typically covers the preoperative consultation, clinical examinations, anesthesia, medications, post-operative checkups, and continuous surgeon's assistance during recovery. Understanding what's part of the quote is essential to accurately evaluate the real value of your treatment. In many clinics, certain expenses may fall outside the initial otoplasty cost. These can include preoperative blood tests, additional medications, corrective touch-ups, post-operative medicines, accommodation or travel expenses, especially for patients traveling from other cities. Being aware of these potential hidden costs helps avoid unexpected financial surprises. Several factors influence the final otoplasty price. These include the complexity of the ear deformity, the surgical technique used, the surgeon's experience, and the clinic's standards and location. Revision surgeries or more complex cases require additional expertise and time. All-inclusive packages that cover follow-ups and post-operative care may cost more, but offer greater safety and predictability. In many clinics in the UK, otoplasty can be paid in installments by offering financing plans in collaboration with banks or financial institutions, sometimes with 0% interest, subject to approval. Patients are usually required to provide identification and proof of income, with installment duration depending on the total cost and financing agreement. Otoplasty is available through the NHS only when considered medically necessary, not purely cosmetic. This typically applies to congenital deformities, trauma-related cases, or documented psychological distress, especially in children affected by bullying. Access requires a referral from a primary care doctor, specialist assessment, and approval by the local integrated care board, with longer waiting times and no surgeon choice. In Turkey, otoplasty cost usually ranges between €1,500 and €3,500, often offered within all-inclusive packages that may include accommodation and transfers. It's crucial to know that the final costs depend on the city, clinic transparency, intermediary fees, and possible future revisions. Albania has emerged as a highly competitive alternative. At KEIT Clinic in Tirana, otoplasty is performed by highly specialized Italian surgeons, with prices starting from €1,000 for unilateral and €1,600 for bilateral otoplasty, often within all-inclusive packages that cover accommodation, airport transfers, multilingual assistance, and structured follow-ups. Otoplasty is more than a cosmetic procedure. It's a precise surgical intervention that requires experience, transparency, and long-term planning. Understanding real costs, inclusions, and international options allows you to make a safe, informed decision. At KEIT Clinic, over 22,000 procedures and 11,000 verified patient reviews stand behind our expertise. If you're considering ear pinning surgery, book your free consultation today at www.keit.al and take the first step toward balanced, natural results.